Hello everyone, I hope you will be fine. Today I want to discuss some basics about breast cancer and to overview about breast cancer. Then how should one do self-examination and when should you see the doctor. Okay, first of all, you all should know that breast cancer is the most frequently diagnosed and leading cause of cancer death in women worldwide. In the United States, more than 250,000 new cases in 2020, and more than 40,000 deaths were reported. Lifetime risk is 1 in 8 women, nearly 1 in 50 by age of 50. Median age at diagnosis is around about 61, and about two-thirds of new diagnoses have no significant risk factor. Male account for 1% of the breast cancer. Now, moving toward the risk factor. So, the risk factor or female gender, older age, nulliparity, early menarche, mean young age at first menses, older age at first birth, more than 30 years, lack of breastfeeding, of course, late menopause, about more than 55 years, and hormone replacement therapy. Also, risk increases with more first degree relatives. When first degree relative have breast carcinoma, then risk increases, of course. Then some genetic studies also present about the personal history of breast disease, atypical ductal hyperplasia, DCIS, LCIS, which are medical terms. Then dense breast tissues have more risk of developing breast cancer as compared to the others. History of radiation during young age, less than 30 years. Okay, high fat diet also is a risk factor, and post-menopausal obesity and sedentary lifestyle. These all are the risk factors for developing breast cancer, but not. These are risk factors, not the causes of the developing breast carcinoma. Okay, now moving toward breast self-examination. There are three steps that are by looking, by touching, and by lying down. So the first step is by looking at your breast while standing before a mirror and look at both breast and nipples. Once with both arms beside your body, once with you both hands on your hips, once with both arms raised and arm behind your head, and look at your breast for any changes. Now by touching, raise your left arm, use the pads of your 3 or 4 fingers of the right hand to examine your left breast. Repeat on the right side. Once in lines up and down your breast from outside to inside. Once in circles around the breast, making smaller circles towards the nipples. Once in wedges starting from outside towards nipples and back again. Okay, so now while lying down, lie on your back, left arm over your head and a pillow under your left shoulder. Examine your breast with your right hand as described before, of course, the left breast. Repeat for the right side. This position flattens the breast and make it easier to examine. Now for a lymph node examination, place your left hand on your waist. With your right hand, try to find enlarged lymph nodes in the left underarm area and around your left collarbone. Repeat on the right side. Enlarged lymph nodes feel like a corn, kernel, or bean. Okay, now if you feel after examination a lump or redness or nipple discharge, nipple retraction, or lump under armpit, you should consult the doctor or specifically the oncologist which deals the cancers. Doctor will examine you and will advise you ultrasound breast or mammography according to your age. If you are less than 40 year, then he or she could advise you ultrasound, or if you are more than 40, then doctor could advise mammography. One should not get panic because now in this modern era, if you catch it in early stages, then it could be treatable. Treatment depend on your stage. It could be surgery, chemotherapy, radiation, or all. And surgery could be breast conserving or could be whole breast removal. One should not be panicked because it could be inflammatory changes, or it could be normal during menstrual cycle, or it could be a benign condition. So, in last, you should not worry about this. Consult your doctor at time if you feel some changes in your breast, and these are about breast. So, yeah, stay healthy, stay blessed. Bye.